Hello and welcome to our COVID-19 update, where we'll be talking to the Honorable Minister of Health, Dr. Frank Anthony. Good morning, Minister, and thank you again for speaking to us today. Let's get right into it, and can we have an update on the situation in Region 1?
Thank you once again for having me on this program. As it pertains to Region 1, you know the hotspot that we've been monitoring is really Quibana. And about 2 weeks ago, we had about 62 cases. Now we're down to 37 cases. And over the weekend, we expect to discharge a number of other persons. So I think the measures that we have put in place in Quibana have been working, and that's why we have gotten a reduction of cases. We still have a medical team on site, and they would continue to monitor persons who are in isolation, and again to monitor them to make sure to see that they're okay, that they don't have any signs or symptoms, or if they do, then to take the necessary actions. But so far we are very pleased with the way that people have been collaborating and cooperating with us in Quibana. The Village Council has really helped us, and they have worked very closely with the Ministry of Health. And I think because of their collaboration, we have been able to curtail the amount of cases that we have in Quibana.
So that's Quibana. What about the surrounding villages? I know you would have indicated that there would have been some monitoring in them. Any indications that there are cases or there been an increase?
Again, we initially, about 2 weeks ago, we had seen a couple of cases in and around Quibana. But we have taken, again, similar actions, not lockdown, but actions where we would have gone into the community, talked to the residents, isolated those who have tested positive, and we have been observing them. So those numbers are going down as well. And I think once we remain vigilant and the community remains vigilant, that we will see those numbers decreasing even further.
Okay, thanks for that, Minister. Now, as the situation relates to St. Cuthbert's mission, has the residents been adhering to the COVID-19 guidelines and the lockdown?
Well, St. Cuthbert's has been a little bit challenging. We have spoken to the Village Council. We have been working with them, and they have been helping us by talking to the residents there. It's quite a large village, and they're spread over, I would say, a large territory. And therefore, sometimes trying to monitor everybody can pose a challenge. However, the main entrance into St. Cuthbert's and exits, we have been having a presence there, and we have been deterring residents from going out. We have continued to do testing, and as of today, we have had 168 persons who are positive. And as we do more testing, I expect that those numbers would go up. So we have to get people to self-isolate. We have to get people to reduce their social activity within St. Cuthbert's. And I guess once we're able to accomplish that, some level of social distancing within the community, people stay at home and so forth, then we'll be able to bring the cases under control. We have added a medical team there, and they're currently on the ground, would remain there for the duration of this lockdown. And through CDC, CDC has been helping them with hampers. So I think in about 2 weeks, 3 weeks, we should be able to control the amount of cases that we have there, and we should see a steep decline.
Okay, thank you so much for that, Minister. Can you give an update on the antigen tests which were ordered by the Ministry of Health?
Well, we have been looking at 2 sources for antigen testing. And just to be clear, not to confuse maybe our listeners, there are 3 main types of tests that we have been using or have been used during this pandemic. The first one, which is the gold standard, is what we call a PCR test. And that was the one that we've been using to make diagnosis of COVID-19 here in Guyana. We have two labs that have been certified to do that. That's the National Public Health Reference Lab and Eureka Medical Laboratories. There are other labs that have applied, and we are going to assess them to see whether or not they have all the things in place to be able to do PCR testing. In addition to PCR testing, there are some tests that would test for the virus itself or fragments of the virus, and those are called antigen tests because it's checking for pieces of the virus. These are generally rapid tests. They take between 15 to 20 minutes sometimes to be able to perform them, and you get a result. So an antigen test, what you do is you do the normal swabbing, you put it in one of the containers. That container would have a special reagent inside. You twirl it around a couple of times, and you create some drops, and then you take a few of those drops and you put it on a strip, and if the person is positive, some lines would appear. That takes 15 to 20 minutes to complete that process. So it's a very simple process, and you would be able to get a fairly good picture of whether this person is positive or not. Our intention and the protocol that we have been developing for the use of these rapid kits is to use them on people who would present with certain signs and symptoms, whether they have like fever, headaches, aches and pains, you know, the typical signs that one would now associate with COVID. So if you have signs and symptoms, we'll use these rapid tests to confirm. So a combination of the clinical picture plus the rapid tests would give us a very accurate picture that this person is having COVID. If we have any doubts, then we'll then revert back to doing a PCR test. So the types of, we have ordered 2 sets of rapid tests. One set is coming from the US, and these are the tests that are produced by Abbott Laboratories. And the name of the test, I think it's called PanBio. So those take like 20 minutes to do. And we have ordered a second set of tests, rapid tests, through the Pan American Health Organization. And they, I think, are sourcing it out from South Korea. And these tests, again, takes about the same time. And the methodology is similar to what happens with the PanBio test. So with these 2 sets of rapid tests that we will now have, we intend to deploy them around the country, and more so into the hinterlands because of the challenges sometimes of getting these swabs out so that we can test them for PCR. We think that it can make a big difference in the hinterland community. And because it's relatively easy to use, once you train health workers how to do them, they'll be able to perform them quite easily in those communities. So you don't require laboratory infrastructure. You can do them right on the spot and get a result. So we think this is ideal for us to use in those communities, and that's where we are going to deploy them. Now, the other type of test that is available, but we have not been using them, is what you call an antibody test. An antibody is generated by your immune system as a reaction to the virus. So these tests would check to see whether your immune system would have reacted and you have produced antibodies. So as you can imagine, they take some time from the time you're infected with the virus for your immune system to react and develop antibodies. And so when you start detecting antibodies, it means that more or less that person would be non-infectious in most cases, and therefore it's more for screening purposes rather than for diagnostic purposes. And so there's a big difference between the 2 types of tests. And I know early on in the pandemic, when people were not differentiating between the 2 tests, that they would do an antibody test and it comes back negative, and then when they do the PCR and it comes back positive, they're wondering how one test is positive and the other is not. But it's the type of test that we're using. PCR would accurately detect if you have the virus and are very sensitive very early in the epidemic to be able to detect the virus, whereas an antibody test would only be effective after a couple of weeks of you having been infected and your immune system would have reacted. So I think that's very important for people to understand because I think people still have that little confusion.
Thank you so much for that, Minister. Let's talk a little bit about the Diamond Diagnostic Center. Some time ago, you would have mentioned that it's being converted into a smart hospital. Now, for Guyanese, can you explain to them what exactly is a smart hospital?
Uh, it's a term that is being used by hospitals in the European Union, and we have really borrowed that concept from them. One of the whole idea behind smart hospitals is to make them resilient to climate change. And the way that you make them resilient to climate change, you know, in our conditions, hospitals, health centers can be easily flooded when we have a lot of rainfall. We're in the tropics, so we have an abundance of sunshine, but we don't utilize the sunshine that we have in terms of converting that into energy. So what we have done with this whole smart hospital concept is to ensure that these hospitals would not be flooded in case of rain. And in fact, when it rains, we must be able to catch the rainwater and utilize it in a more sustainable way. And when it's sunny, that we can have solar panels that would take the sunshine, convert that into energy, so that we can utilize it for the appliances that we are running. So that's one area that we have remodeled the Diamond Hospital to be more, to use sustainable energy then, renewable energy in terms of solar and to make the facility more climate resilient. The other area that we have looked at is that the whole layout of Diamond internally, patient flow was not as it should have been, ideally in a hospital setting. The rooms there were very cluttered, and for you to get from one area to another area, there were too many corridors that you had to negotiate to get from one place to another. And that's not really friendly to a patient, especially somebody who's in pain and so forth. So what we have done is to redesign the interior of the facility to allow for optimum patient flow. So if you have to move, say from outpatients to get to one of the doctor's office, it's right nearby. From the doctor's office, you need to get your prescription filled, it's not far away. If you have to get a diagnostic test, it's right within your reach. So we have redesigned the facility to allow for that efficient flow of patients, and hopefully that would improve the kind of quality of service that we're offering. Now, this concept has worked very well in Europe, and we are borrowing that concept and adopting it here in Guyana. And the first project is really with the Diamond Hospital. Originally, sometime next year, we were supposed to get back the facility, but I think the contractor has worked really well, and we are hoping that we can get that facility back in December, and so that we can return back to normal services at Diamond. And while we finish off Diamond, we are going to start on some other hospitals and do the same thing with them, make them climate resilient, put in renewable energy sources and so forth. And so the next hospital that we'll be working on is at Lenora. And already we have initiated some work there, talking to the residents, decanting the services that we currently have at Lenora, and we'll start work on the actual hospital building. We also are going to do similar work at Mabaruma, Lethem, and Paramakatoy. So using the smart hospital concept, we have already 5 hospitals where we will be using these principles to enhance the facilities that we have. The funding to do all of this is coming from the United Kingdom, and so that funding is already here with us, and we have been using this to implement these projects. Through that funding as well, we have assessed about 100 other facilities in Guyana to see if we need to upgrade them and do similar things using these principles, what it would cost, what are the things that we'll need to do to upgrade them to being a smart health center or a smart hospital. And so we have that assessment, and as we do additional infrastructure works on these facilities in future budgets, we'll be using these principles to guide us.
Last week you would have mentioned that there would have been a team of Americans coming in to train some healthcare workers. Can we have an update on that?
Well, the team is going to be here, and the training is primarily at our regional hospitals. So we'll be working with them, especially in how to do management of severe and critically ill COVID patients. And I think the training is absolutely necessary, especially for those interior areas, because if you have a patient that really needs ventilatory support, then you should be able to provide that, and you should know what to do. So that's what this training is going to do, and we are extremely happy that we can collaborate with the U.S. government to provide this training.
Do we have a timeline on when the team is expected to arrive?
I think the team is going to be here sometime next week, and they're going to be working with us for the duration of about a week. But they'll be moving from one side to the other.
And wrapping up, Minister, the government would have recently published its 100th day in office. What are your immediate plans for the Ministry of Health?
Well, I think during this last 100 days, we have put a lot of our focus on trying to respond to the COVID-19 pandemic. And I think we have vastly improved how we respond to the pandemic. In terms of the ministry's capacity, we have more bed capacity now, we have more ICU beds, have more equipment in place for ventilatory support and all of that. We've been able to bring in medicines that we can use in the ICU. So I think we are in a very different position than we were 100 days ago. We have also worked with the COVAX facility to be able to secure vaccines for Guyana, train staff, so there are many, many things that we have done. And I feel that we are in a much better place to respond to the pandemic, but we cannot be complacent. And so moving forward, while this continues to be one of our priority, we are also focusing on many other areas that the ministry would traditionally work in. So we have engaged, for example, the Global Fund to ensure that funding for HIV, TB, and malaria continues. We will put in a proposal to them early next year to ensure that funding in these areas would be adequate. And we have to continue working with the patients that we have for these specific diseases. In addition to that, we have also been working on eliminating what is called tropical neglected diseases. And one of those diseases include filaria. And about a year ago, we were able to do mass drug administration for filaria. And for us to eliminate it, we have to do a second round. So that second round is planned for in the first quarter of next year. And we have already advanced the planning for that, getting in all the medicines to be able to distribute that. We have started training staff who would be going around to distribute the medication. So that's another area that we've been looking at. In terms of other infectious diseases, malaria, of course, is one of our focus. And you would see us roll out a program where we will be, especially in those areas that have a higher prevalence of malaria, you will see us roll out a program giving out bed nets. These are insecticide impregnated bed nets. So when a mosquito comes to the net and they ingest the insecticide that is on the net, it would kill the mosquito. So we'll be distributing that across various communities, especially in the hinterland. And that program, we'll roll that out maybe in another couple of weeks from now. On the chronic disease side, we have been looking at the various chronic diseases that we have. As you know, among the top 10 diseases, you have many of them are chronic diseases that would really cause death to a lot of Guyanese citizens. So we have to pay attention to that. So we have been looking at how we can expand and develop our program in cardiovascular diseases, not just looking at the curative side or what you do when people get complications, but we want to have a stronger program in terms of prevention. Similarly, we're looking at diabetes and what we can do in terms of preventing diabetes, but also taking care of patients that would have complications of diabetes and how you monitor those patients. So you would know that we also have a foot clinic where we help patients to manage their feet and how they can care for that. But we have now also been rolling out a program where we can do checks for people's retina. You would have seen recently we've extended that service to the Enmore Polyclinic, and you would see us over the next maybe year or so extending this type of service where we are able to check the retina of people who are diabetics to monitor them and to make sure that they're doing okay and they wouldn't go blind. So our intention is really to have those type of equipment in each of our hospitals. So there are many, many things that we're doing. So we are trying to cover both the infectious diseases and the chronic non-communicable diseases, and we have the team in the ministry who are really working at this. Concurrently, we are also developing a next strategic plan for this ministry, which would go for the next 10 years, and we'll cover all of these different areas as we move forward. So while we deal with the pandemic, we are also looking at moving forward with other areas in the ministry, and the team is working to make sure that we stay focused on all these matters relating to health.
Okay, thank you so much for that, Minister, and thanks again for talking to us today. That has been our COVID-19 update for today. For more information, you can visit our website, dpi.gov.gy, or follow our social media platforms.